and I'm speaking on behalf of Disability Rights Texas, and appreciate all the discussion that has happened today and all of the things that this committee is thinking through in terms of what to do about it, both getting the data and potentially, rescinding denials, stopping denials, all those things. One thing that wasn't mentioned yet, and I think it's worth noting, is that assuming a family gets to a hearing, one of the things that is problematic, and really it is that sort of underlying fundamental problem, I think, that's showing up in many different ways now, is that it's our belief that by virtue of all these denials, the children that have been on the program and approved for many, many years, that in itself should be proof enough that the instrument that's being used is not valid. And the instrument that is being used is not in alignment with the TAC, the rules around medical necessity level of care. So as soon you get to a hearing, the evidence that generally is going to get presented that the hearing officer may listen to and may struggle with how to, make a decision, is that they're going to be looking at the instrument, which is fundamentally, in our view, not valid at this point, not just inter-rater reliability, but it's not picking up on kids who have been proven or would be proven to be eligible for a nursing facility level of care. So when that hearing officer, is looking at the evidence, they're relying on, what comes out of that assessment. So that is a big problem. So, because the fundamental flaw that the assessment is not valid may not be recognized at that point by the hearing officer. We do get involved in a lot of these cases. We have a very good success rate. We are concerned about the people that we don't hear from. And we are concerned about hearing from so many and trying to really get at what you all are asking for, which is a fundamental systemic fix to it. So I support everything that you all have suggested, and just wanted to talk a little bit about the dilemma of you get to a hearing, but the hearing officer is going to rely on this assessment, which isn't in a valid way picking up on the fact that a child would meet medical necessity for admission to a nursing facility.
I think that's the bottom line. I think that the assessment, while it's very comprehensive, is really looking at medical necessity for ongoing skilled nursing, which is a little different than the eligibility for nursing facility admission. And I think that we are, by putting in place this different assessment, we are now unduly terminating people from services. So I guess that, and I do appreciate HHC and all of the work that you all are doing to try to come up with a long-term fix. I guess the answer is, what's the short-term protection for children and families while the long-term fix is being.
So we had, during